a 25-year-old man presents with a nodule on his right foot. He says that he first noticed the nodule last week. It has not undergone any change in size and color. He denies any history of trauma or fever. The patient's past medical history is significant for HIV, diagnosed 6 years ago. He is currently not on antiretroviral therapy. His last CD4 count was 0.9 into 10 to the power 9 per liter. He is afebrile and his vital signs are within normal limits. On examination, there is a 3 into 4 centimeter nodule on his right foot, tan brown in color, non-tender and covered with a fine scale. A biopsy of the nodule is performed and histopathology reveals proliferation of blood vessels with overgrown endothelial cells. Histological staining of biopsy reveals gram-negative bacilli. Which of the following is the best course of treatment? All right. Okay, this is basically your, as mentioned over here, bacillary angiomatosis, which is caused by your Bartonella. Okay, so Bartonella is a gram-negative bacilli which causes bacillary angiomatosis. All right. This and this is very which can be it is very common in HIV patients. All right, immunocompromised or HIV. Okay, and the drug of choice for treatment is your macrolides, erythromycin, and doxycycline. Okay, so erythromycin or doxycycline, either of these drugs, right? And there is one disease which you can confuse with the yes, I'll repeat the diagnosis. So this is bacillary angiomatosis caused by Bartonella, which is a gram-negative bacilli. All right, bacillary angiomatosis. There is one diagnosis, one differential diagnosis which is very confusing, and they usually try to test it out in some way or the other. But here, since it's mentioned here, gram-negative bacilli, so you could easily rule it out. Otherwise, there is one thing which can be confused with bacillary angiomatosis. Anyone would like to give me an answer? All right, so it is basically Kaposi sarcoma. It is mentioned over here. So basically, how to differentiate between Kaposi sarcoma and Bartonella and bacillary angiomatosis is you have to do a skin biopsy. There is no other option. In the skin biopsy, Kaposi sarcoma will be neutrophil predominant and Bartonella and bacillary angiomatosis will be lymphocyte predominant. All right. Both will have proliferation of vascular endothelial cells. Okay, both can present similarly red, purple, flesh-colored nodule type of structure. They can be solitary, multiple. These are not ways to differentiate, but the best possible way to differentiate is skin biopsy. Skin biopsy helps to differentiate between bacillary angiomatosis and Kaposi sarcoma, as mentioned over here. In Kaposi sarcoma, you will have neutrophil predominant slide. Your slide will show predominance of neutrophils. And for bacillary angiomatosis, it will show predominance of lymphocytes.
Thanks for watching. Please give a thumbs up and subscribe for more.